This video is of the neuro examination. First, you want to assess the mental status of the patient, so you'd ask them why we're here today.
For a neuro exam.
And then you would ask them what day of the week it is.
A Sunday.
And do you know where we're at right now?
Yes, your house.
Very good. Alright, so cranial nerve 1 is the olfactory. It's usually not tested unless there's an issue. But moving along to number 2 is the optic nerve, which is the visual fields. So you would want to have the patient follow the pen light or whatever object that you might have them follow, your finger. And this was also done with the visual testing that we did before. I follow that inward. Very good. And number 3 is ocular motor. Extraocular eye movements, which she didn't have any whenever I was doing that. There was no nystagmus there. Also, it's responsible for the pupillary responses, so you have the patient look at your face and look at their pupils, and they should react. Her pupils are about a 3, and they're round and reactive. You would also have the patient look here, and they're smaller, and then when she looks away, they do accommodate. They get larger whenever she looks further away from a close-up object. Cranial number 4, trochlear. We also tested that whenever we did downward eye movements. That's the responsibility of that nerve. Nerve number 5, trigeminal. It's responsible for the chewing, so you would have the patient move their jaw side to side, up and down. And everything felt okay in there. It's also responsible for sensations of the face, so you would take some cotton and close your eyes. And ask if the patient feels that.
Mm-hmm.
No problems there. Cranial nerve number 6 is the abducens, lateral eye movement, which was observed when we were doing the visual fields as well. Facial nerve, the facial muscles, and that's responsibility of that one, so you would have the patient puff their cheeks out. Very good. She wouldn't be able to do that if there was an issue with that nerve. Acoustic, or the hearing. You would do the whisper test. Repeat it.
This is the whisper test.
And then again in this ear.
The same thing. This is the whisper test.
Very good. Glossopharyngeal, which is responsible for the patient swallowing. She's not drooling or anything as we're speaking, and she's able to swallow her own saliva. Also, whenever you're doing the neck assessment, you're also observing that whenever you're palpating the thyroid and you have the patient swallow. Go ahead. And again. The vagus nerve is responsible for talking and swallowing as well. It's also responsible for some other features which we're not really testing right now. The spinal nerve is a trapezius movement. And the sternocleidomastoids, can you shrug your shoulders up and resist me there? That's good. And resist my hand. That's good. Resist again. Very good. And the hypoglossal is the movement of the tongue, so you'd have the patient say, ah. Very good. Motor function is you're also looking at we kind of did this in the past video, if you would conclude them together a little bit. The muscle size, you're also looking at the strength, which we knew from the video before, it was a 5 out of 5. Gait and balance, she had no problem walking in here. She doesn't complain of any dizziness. If I could get you to lay back on the bed here. Sensory function is the knee flexion. I'm sorry. I'm going to flex the knees. And you also also did that in the past video where you're observing the palpation, if you feel any crepitus or any abnormality whenever the patient's moving their joints around. You could also do, now I want you to close your eyes, and I have a poker here. It's a flat side and it's a sharper side, so I want you to tell me which one's which.
Flat. Pokey. Pokey. Sharp. Sharp. Dull. Pokey. Or sharp. 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 Dull. Dull. Dull.
This is our expensive tuning fork here. It actually would work because it actually vibrates a little bit. So you put this on the patient's arms, and then you want to make sure that they're able to feel the vibrating.
Yes.
And you do the same thing for the legs.
Yes. Yes. Yes.
Okay, I want you to sit up again for me. Now I'm going to hold your arms out here, and I want you to close your eyes again, and I want you to tell me if we're moving up or down your hand.
Down. Down. Up. Down. Up. 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 Down. Down. Up. Up.
So I'm testing the positions, if she knows that things are up or down, part of the neuro assessment. Next thing is the reflexes. We did test some reflexes. The corneal reflex, if you just keep your eyes open and brush the cotton there, and she blinks. That's what should happen. And then in earlier assessments, whenever you're doing like the throat, and you do the gag assessment with the popsicle stick as well. This is the bicep. I'm not very good at this. So she's gonna tap in there. And you should get a small little jerk. You would note if there's any clonus, which is like a repeating movements, like spastic kind of. That was testing the triceps. Biceps. This is triceps back here. And then this is the biceps here. And the wrist. The patellar, if I could get you to on the bed again, just because of the camera. The Achilles. Achilles again. As I said, I'm not that great at it, and it does take practice. So that concludes this video of the neuro assessment. Thank you.